Welcome to Headline Buster, brought to you by The Point with me, Liu Xin. In this series, I dissect stories that are making headlines around the world and talk to my guests to compensate for the missing pieces of the puzzle. So join us in real time by sending us your comments or questions via the CGTN page on Twitter, Facebook, YouTube or Weibo. If you're watching this live on the CGTN application, email me at thepointwithalex@cgtn.com. Let me know what you think. We'll bring you Headline Buster on Fridays, so do get in touch and we just might read out your comments. Since Darwin's On the Origin of Species was published in 1859, there hasn't been so much furor over another evolution theory. Yes, I'm talking about the origins of SARS-CoV-2, the virus that causes COVID-19. Did it come from nature or did it leak from a lab? The sensational theory some love to believe. We went through all this hullabaloo already. Why are we discussing it now again? Because there's been a call for yet another probe into the so-called lab leak theory. Will it get us to the bottom of the matter, or is it simply chasing the suspect in the wrong place? Before we look at how the media covers this first, a flashback into the past. Based on a resolution by the World Health Assembly and consultation by member states, a joint China-WHO team of experts conducted what's known as Phase 1 of the Origin study in Wuhan in January and February this year. Right after the mission, Peter Ben Embarek, mission co-head, said this.
The findings suggest that the laboratory incident hypothesis is extremely unlikely and to explain the introduction of the virus into the human population, and therefore is not a hypothesis that will implies to suggest future studies into our work to support our future work into the understanding of the origin of the virus.
In March, the team released a joint report officially describing the lab leak hypothesis as extremely unlikely. But the theory gained momentum in May, around the time when a Wall Street Journal report claimed 3 researchers from the Wuhan Institute of Virology became sick enough in November 2019 that they sought local hospital care. Despite China's repeated calls for disclosure, the names of the 3 remain elusive. In May, US President Joe Biden asked his intelligence community to come up with a definitive conclusion within 90 days. In June, G7 countries demanded a WHO-led Phase 2 study. Biden once more aired his lab leak liking, saying a question mark still hangs over whether the virus was, quote-unquote, an experiment gone awry in a laboratory. On July the 15th, WHO Director General Dr. Tedros Ghebreyesus said there was a premature push to especially reduce one of the options, like the lab theory. The next day, at a briefing for WHO member states, he proposed a Phase 2 plan to pursue further studies in Wuhan, including audits of relevant labs. China reacted promptly. On July the 22nd, Zheng Yixin, Vice Minister of China's National Health Commission, said this during a presser convened specifically on this topic.
China cannot accept the current version of the second phase investigation because the plan has been compromised by political manipulation and disrespect of scientific facts. The WHO plan to focus on lab leak shows disrespect to common sense and arrogance for science.
What is China's position then? Now, China believes the second phase should be an extension of the first one, guided by the relevant WHA resolution and conducted after thorough discussions and negotiations among all WHO members. What was done in Phase 1 study, especially by those that have reached a clear conclusion, should not be repeated. Studies on origins in animals should be the focus. China also believes the next phase should still be conducted under the overall planning and coordination of WHO. As to the possibility of a lab leak, Liang Wannian, head of the Chinese team, said that that should not be ruled out if there is new evidence But then similar studies should also be done in labs in other countries which haven't been put under scrutiny. Now, looking back at how the lab leak narrative has gained momentum, what has been the role of the media? We decided to do a data analysis. We went to the home pages of 5 media outlets, CNN, New York Times, Wall Street Journal, BBC and The Guardian, and searched for 3 keywords: coronavirus, origin and Wuhan. They show 238 articles published between December 2019 and now. And these are the words used with the highest frequency in the articles. As you can tell, China, Wuhan, lab, WHO, Chinese, scientists, so on and so forth. Of course, words such as animals, human and theory also feature very frequently. Now, this table I'm going to show you will show the kind of interrelationship between the keywords lab and Trump. And they were featured in the same reports. Now, the pair of words first made a small spike in late April, early May last year, when Donald Trump told reporters he saw credible evidence that the virus came from a lab in Wuhan, and he was seconded by his Secretary of State Mike Pompeo. Neither have produced any evidence till this day. And this table now shows how the appearance of the word lab suddenly shot up in May this year, following the so-called exclusive report by the Wall Street Journal on those 3 researchers falling ill in the Wuhan lab. In contrast, the yellow line represents the fluctuation in the appearance of the word animal. So there you have a rough idea of how powerful the media is in framing the narrative and setting the agenda. With politicians and some in the media working in sync, the lab leak narrative gained momentum. Insinuating, naming, shaming and blaming have effectively spun a conspiracy theory into a plausible hypothesis. Meanwhile, a barrage of ferociously negative names are being thrown at China, effectively deflecting from some countries' domestic failures in handling the pandemic. On July the 5th, the medical journal Lancet published a statement by 24 renowned medical scientists after they published a similar one a year ago. The scientists reiterated their solidarity with their Chinese counterparts and expressed their professional view that the virus most likely originated in nature and not a lab. But specifically, how have different media reported on this topic? Let me use the latest Chinese presser as a case in point. At first glance, all of the media headlines from the July 22nd presser seem to be uniform. For example, CNBC says China rejects WHO plan for study into COVID-19 origin. Al Jazeera says COVID-19 origins. China rejects WHO proposal to return to Wuhan. Hindustan Times says China rejects WHO proposal for second COVID-19 origin study. And the Washington Post headline is China sets back search for COVID origins with rejection of WHO investigation proposal. What impression do these headlines give you? That China is difficult and secretive. But what did the presser tell us? China is not objecting to further studies of COVID-19 origins in China, just not the Wuhan lab leak hypothesis. In fact, as disclosed by Liang Wannian, tracing work by Chinese scientists in animals such as pangolins, civets and more have been ongoing after the global study in Wuhan earlier this year. This is the nuance that's mostly lost in the above-mentioned titles. Another question in point is transparency. That China has not given access to raw data to help international experts understand the earliest cases in Wuhan. But how valid is this allegation? That leads me to my second sample, a Reuters report, which is titled China Rejects WHO Plan for Study of COVID-19 Origins, and it also made reference to this point. At the presser, the Reuters reporter asked, is China willing to provide raw data that might reveal the early transmission of COVID-19 in Wuhan? If not, can you explain the reason? Again, Liang Wannian answered this question.
In fact, these patients' data were all displayed and shared during our stay in Wuhan. However, China has relevant standing regulations regarding patients' clinical data, including epidemiological survey data and laboratory test data, which involves personal privacy. If the data is completely released, this will violate the relevant regulations. At the time, international experts also fully understood and believed that this was international routine, not only in China.
So Liang Wannian said the data was available for the experts to study and analyze on site, only they couldn't make copies or photos of these documents. But the Reuters report says China reiterated its position that some data could not be completely shared due to privacy concerns. What does that mean? For readers who have not followed the matter closely, the impression would be that China did not provide these documents at all. However, in fairness, not all international media have pursued their own narratives in reporting. The press are presenting China as uncooperative and secretive. The South China Morning Post report entitled "China Rejects WHO Plans to Revisit COVID Lab Leak Theory in New Investigation" indicates China doesn't oppose a second phase of investigation, but chasing a conspiracy theory. The article also mentions the American hands that floated the lab leak theory, especially the Trump administration. And an earlier report by the same daily also strikes a different note from the rest. It says, proposed WHO origin study inconsistent with China's position. This is a more accurate depiction of China's stand. In conclusion, it is a highly specialized matter and extremely difficult for the general public to follow and make judgments independently. That's the risk of talking about it in the media. Unfortunately, at the same time, we all have an obligation to inform the public to the degree we can, hoping we can do that in the most responsible way possible. With that, it's time for a quick break. When we come back, let's see what our guests have to say. Stay with us.
Making sense of the overwhelming wave of information means cutting through the noise to shine a light on the heart of the story and making room for new perspectives. True understanding means the ability to see events from more than one side. I'm Liu Xin, and this is The Point.
Welcome back. For more on the discussion, I'm pleased to introduce to you our guests today. They are Professor Zhiwei from the Center for Public Health Research Medical School of Nanjing University. He's joining us from Nanjing, China. From Washington, D.C., Dr. Eric Ding. He's Senior Fellow of the Federation of American Scientists. And from Washington, D.C. as well, Dr. Kate Tulenko. She's CEO of health service provider Corvus Health. Thank you very much for making your time available. So this is a very important discussion, and I have just talked about the role of the media in how we get to the situation at this moment. Ms. Tulenko, let me go to you first. You have worked in both developed countries and developing countries, as we have seen that despite the conclusion of the joint WHO-China team calling the lab leak hypothesis extremely unlikely, politicians in some developed countries and even scientists, some and especially pundits as well, just refuse to believe that. What do you think is behind such sentiment? Do you think there is a bias against scientists in developing countries, including China, a feeling that their skills, their professionalism, their protocol is somehow not good enough, not up to international standard?
I don't think the issue is a bias against Chinese scientists. I think people are fully aware that the many Chinese labs work with the NIH, they work with the Koch Institute in Germany, they work with the Wellcome Institute in the UK, the most important labs in the world. So I don't think that's the issue. I think it's important to realize that there are three types of people involved in this dialogue about the lab leak hypothesis. The first and most important group is the scientists, the evidence-based people who just want to understand the origin of the pandemic so they can prevent other pandemics from happening or stop them earlier. And then the second group is the politicians, people like President Trump who are trying to sort of, weaponize the issue and trying to harm China's reputation. And then the third type of people is the anti-science and the anti-vax community. And they want their message is that all labs are dangerous, science is dangerous, modern medicine is dangerous, and they're trying to make people afraid of having labs in their communities or afraid of having research institutes in their communities. So I think it's more about that discussion. And the folks in the WHO said that they did feel pressure to kind of move more quickly in putting away the lab hypothesis. And WHO says that they haven't had access to all the data that they've asked for, and that they want to be able to look at that data.
So actually, on your last point about they were not given adequate access or enough data to understand the very earliest cases, I believe that it has been explained multiple times in the press conferences, which was held on July the 22nd, where they reiterated that scientists were given enough access, that they were given these raw information, except that they were not allowed to take photos or make copies of these original documents and take them away. So Dr. Wu, how do you understand the situation?
Well, when the WHO team came to Wuhan to conduct the studies, actually, they are actually fully cooperated by Chinese side. They went to the lab and look at the research records and look into all how the protocols, actually how the studies were conducted in the lab. And also they went to hospitals and talked to people, and they also went to the wet market as well. I think they were given full access to various different places they actually wanted to go. And if you look at the press conference afterwards, and presented by a number of participating scientists, I mean, I don't hear any complaints that they were denied of the access to what they wanted. I think this is something actually we have to bear in mind, is that if you are not allowed to make photocopies, I think it's quite reasonable if this is involving some personal information, and I'm not surprised because there is privacy issues involved. I actually worked in the U.S. for more than 20 years. I mean, I'm not surprised if you just go to any U.S. lab or hospitals trying to make photocopies, you are not allowed. This is a privacy issue. So. If we take the words from the participating scientists and people in the team, actually, I'm pretty confident that they do get access on what they wanted.
This is a very interesting discussion, and it's the very first time that international collaboration in this field is carried out, and it is important to do it according to the proper protocol, according to science. And we all know that the whole thing is based on a mandate that is set forth by the World Health Assembly resolution to look into the zoonotic source of this virus. And the work protocol is concluded by both the WHO and China, and they are working towards that goal. All the international experts were selected and approved by the WHO. They worked in China, they come to this joint report, and now the WHO say what they came up is not good enough. So Dr. Tulenko, because you were mentioning the importance of being in an international organization, I want to stay with you. So how should this kind of study be concluded? I mean, by when can somebody say, okay, the report is good enough, we can move on? Because everything has been done according to protocol.
Well, I think that China could ask the WHO to give them a list of the data that they feel they need. And then once that's satisfied, everything will be completed. But, in the longer term, this is a huge opportunity for China to be a leader in transparency and be a leader in showing that they can give de-identified patient data. For example, when you look at how the AIDS virus was discovered and looking at patient data, they were able to in the 80s to de-identify patient data. And China is working to create one of the largest patient data platforms in the world for use for research. So for that, they'll have to be able to de-identify patient data. So once again, it's a chance to be a leader and show that China can provide this de-identified patient data.
Dr. Wu, what is your take from your perspective on this issue? Exactly how such study should be conducted, and given the kind of impasse we're at this moment, what is the way forward?
Well, I think, under the current political environment, it's very hard to do it, because the whole thing was initiated by American politicians, and that actually poisoned the whole entire scientific research research and investigations. One of the issue here is that when the WHO changes position and pushing for a second time studies or investigations, one of the problem is that it did not consult with China and did not provide any reason why they need second investigations and studies. That's the real problem. I mean, to China, it's a humiliating act. I don't think any sovereign country will be able to accept such changing of the positions. I think, one of the issues is that if we do want to understand and know where the virus came from, we probably need to conduct overall or more comprehensive studies and opening up not the lab in China, but also in other countries as well. And not only in labs, but also in hospitals as well, because we do see a number of reports that in clinical settings, we do have certain evidence that the COVID-19 appeared earlier than the end of year 2019. So that's what we need to do.
Dr. Ding, again, I want to make this distinction. There are two different paths moving forward. One is to revisit the lab leak theory as is suggested by the phase 2 plan proposed by the DG of WHO. And the other two is to focus on the natural origin of the virus, including looking in China, in other places, in wild animals, in all of these places where, the virus could have jumped from the nature to human. So the second one is what China is suggesting to focus on. And this is what we're talking about. China is objecting to the first one, to go down this path that's already deemed extremely unlikely, and just now you called it a conspiracy theory as well. So what is your position here?
I think, if we're open-minded scientists, we should be. Why not both? We have the capacity and the bandwidth worldwide to do it. It's not like there's only one tunnel and this is the only, it will allow one car through this tunnel at a time. There's lots of interesting questions that are still outstanding, such as, why was the coronavirus SARS-CoV-2 picked up in Europe as early as basically October of 2019? That's an unanswered question, right? Like, where did that come from? Clearly, there was a child infected and their blood sample confirmed in October, November, as well as, wastewater samples that also confirmed in the same area. So we have lots of questions about those, and whether it's a leak from somewhere, whether it is a natural spillover from somewhere, these questions are something that scientifically we should not close ourselves off of where did it originally originate, or what is the origin of it? I think this is, if we're trying to be objective scientists, we shouldn't just pick a conclusion. Oh, let's pick a zoonotic and let's find the zoonotic only. Let's find all the evidence. Like, these things could, in certain ways, I actually think that if it was just a natural thing and then they studied it and there was a lab and it leaked, I think it was an accidental, and I don't think China should be held that responsible for accidental, because there's been leaks of many other viruses from US labs and European labs. It's quite common. I think in certain ways, given that there's precedent, we should know what was the true origin, not just intermediate lab or intermediate host.
So basically you're saying there is the possibility that this virus might have already been cultured in a certain lab. You are now suggesting that this virus could have been edited or some kind of created in the lab.
Yeah, I think the editing, the bioweapon engineering is a completely different conspiracy theory. I think the lab leak is not necessarily a conspiracy. It could just be an accidental event. Just like we have accidental Chernobyl spills, we have accidental spills of toxic chemicals in oil spills.
I got your point. Dr. Wu, what is your answer?
Well, actually, I mean, I agree with Dr. Dean that there is certainly a possibility, but I mean, currently, with all the scientific evidence, actually, probably more favor on the natural origin. We do have, have identified the sequences in pangolin and other animals. I mean, it's a complex issue here that coronavirus has a very broad range of natural hosts. I think this is extremely difficult to identify and trace the origin in the short term. I think one of the issues here, why we are keep talking about finding the origin in such urgency, is of course there are scientific reasons, but they're more basically pushed by political reasons, as we saw in the very beginning. I mean, I'm a research scientist myself. Actually, if you look at the viral origin research, such as HIV, it has been, it was identified for more than 40 years ago. I mean, do we know the origin? No, we don't know, actually. I mean, we have always looking for the origin of this virus. I mean, there are a lot of viruses which are circulating in the world. We have never been able to find its true origin. So it's a very complex scientific issue. Takes time and patience to do that.
To wrap this up, many thanks to my guests. They have been Professor Zhiwei from China, Dr. Eric Ding, and Dr. Kate Tulenko joining us from the United States. And with that, we come to the end of this edition of Headline Buster, brought to you by The Point with me, Liu Xin. As always, you can follow me on Facebook and Twitter using the handle Liu Xin in Beijing. Thanks for watching. You've got The Point.